دكتور مبارك ويانا تسمعني؟ دكتور مبارك تسمعني؟
يا عم اسمع.
السلام عليكم.
وعليكم السلام.
دكتور مبارك، الدورة عددهم ايش قد؟ 500 مو؟ لو 450؟
450.
هسه انت عندك 230 الحضور اللي موجود. اريد تسوي لي تسجل لي الحضور والغياب واللي يطلع بقصد زين ويستمر بالخروج من المجموعة، فاللي مواظب واللي مستمر. واضح؟ لأنه الغيابات هاي راح تكون عليها درجات يعني.
واضح دكتور.
بالنسبة للمرحلة هذه راح تكون الغيابات عليها درجات، والمحاضرات خاصة المحاضرات الإلكترونية يوم السبت. مبلغين ممثل المرحلة مبلغ، هو ممثل المرحلة ويانا محمد شو اسمه؟
نعم دكتور.
منو أنت؟
مصطفى محمد.
مصطفى. اي شلونك مصطفى؟
الحمد لله دكتور.
المجموعة الدورة كلها مبلغة، الغيابات بالباطنية راح تكون عليها درجات ابني.
نعم دكتور.
كل الغيابات راح تكون عليها درجات. هذا النظام راح يكون معمول به للمرحلة مالتكم. واضح؟
تمام. واضح.
فالكل يتبلغ بهذا الشيء. انتم دورتكم حوالي 450 ل 500، حضوركم 230 240 هسه. هذه اول يوم، هاي اول بادرة سيئة عنكم. واضح؟
نعم دكتور.
Okay, you are ready now? مصطفى تسمعني؟
نعم دكتور اسمعك.
اوكي. المرحلة الثالثة. السلام عليكم.
وعليكم السلام.
وعليكم السلام.
Recording in progress.
محاضرات المرحلة الثالثة للباطنية راح تكون مستمرة بالنسبة ليوم السبت من الساعة 10 إلى الساعة 11. الأسابيع القادمة من 11:30 راح يكون للساعة 12:30 عندكم محاضرة إكسترا، لأنه أكو نقص بالمادة أو إضافة مادة بتحديث المناهج، فحتى تكفي راح يكون محاضرتين السبت. راح تكون هاي المحاضرة الثانية أكثر شيء clinically oriented. واضح بابا مصطفى تسمعني؟ تبلغ المرحلة كلها راح تكون بها مواضيع clinical. We focus on a clinical aspect or clinical important subject. هذه راح تفيدكم لأنه حتى تكونون بالبراكتس مالتكم عندكم فد باك جراوند، لأنه أنتم you will have a defect in your training because you have a large volume of groups. So every week you have a next lecture or 1 hour extra for this reason. صار معلوم مصطفى؟
واضح دكتور.
Okay. Today we will talk about the introduction to the internal medicine subject and to the important clinical sign and symptoms of internal medicine disease. We will start by one of important symptoms and important systems in internal medicine. We'll talk about the introduction of to the sign and symptoms of cardiovascular disease. Now, cardiovascular disease is the leading cause of death, mortality, and morbidity over the world. If you take the percentage or prevalence of death among the world worldwide, you can see that on the top of this disease is the cardiovascular disease. We have different types of cardiovascular disease, but most commonly, the patient with cardiovascular disease, you will hear about the term, which is ischemic heart disease. Ischemic heart disease, or what we call it, coronary artery disease. Coronary artery disease, or atherosclerotic heart disease. It means the same. It means the same. So mostly when we say ischemic heart disease, we mean coronary artery disease or coronary heart disease or atherosclerotic heart disease. It means the same. Other presentation for patients with cardiovascular disease is congenital heart disease. We mean by that, when the child is born, he born with some defect in his or her cardiovascular system. You know that the cardiovascular system is consisting from heart and vascular system. And the vascular system, we mean the great arteries and the great veins, the drainage, and the microcirculation. So when the newborn come to the life, he or she might present with some defects. Example of these are VSD, ventricular septal defect, ASD, atrial septal defect. There is a defect between the both right and left atrium, or between the both right and left ventricles, or what we call it, tetralogy of Fallot. You can read about this in pediatric next year. So, or transposition of great vessels, or coarctation of aorta, or patent ductus arteriosus, PDA. So we have different congenital heart disease. Other type of cardiovascular disease is, which is common, which is the hypertension. And you know the hypertension is increasing in its prevalence over the world. Other type of cardiovascular disease, the patient might present with infection to the cardiac muscle. We call it myocarditis, acute myocarditis. And in the last 2 years or 3 years, the prevalence of acute myocarditis was a little bit increasing because of viral infection due to the transmission of a very widespread infection of COVID-19. So the prevalence of acute myocarditis was increasing in the last 2-3 years in comparison with the previous years. So this is another type of cardiovascular disease. Other type of cardiovascular disease, we might see a patient with what we call a defect in their valves, congenital defect or acquired defect, and later on they will suffer from what we call it infective endocarditis. All these subjects you will cover in the next year, in the fourth year, and in the fifth year. Mostly in the fourth year, we will discuss these type of diseases. But in this lecture, I will try to focus on the most common diseases in the cardiovascular system, which is the ischemic heart disease. So as I mentioned, what is the ischemic heart disease? Definition, how we can define the coronary artery disease or ischemic heart disease. Mostly we can define them according to the anatomy and pathology or pathophysiology of the disease. When we mention coronary artery disease, we mean ischemic heart disease, we mean atherosclerotic heart disease. As we know, we have three main vessels that supply the cardiac muscle. Three main vessels that supply the cardiac muscle. Anybody can mention to me the names of the coronary arteries?
Right to left coronary artery.
Yes. So we have right and left coronary arteries. All of them, both of them, they are arising from?
Aorta.
Yes. The right coronary artery will arise from the right coronary cusp in the aorta. We have the right coronary cusp and left coronary cusp. Okay? And the left coronary artery will divide into left main stem, which is the original. It arises from the left main stem, from the coronary cusp, left coronary cusp, and it will divide to the left anterior descending artery and left circumflex artery. So in the left system, we have two arteries. You know that? You understand that point? So the main system, left main system, will divide into two main vessels: the left anterior descending artery and its branches, and the left circumflex and its branches. All these vessels supply the cardiac muscle. When we have a narrowing of one or more.
دكتور بس ما خصك الملزمة مطرة.
احنا ما عندنا ملزمة. موجود الكتاب عندكم بالديفيدسون.
زين الكاميرا مفتوحة عليك.
نعم.
الكاميرا مفتوحة عليك.
اوكي بس الصورة انا احكي لكم حكي، ما عندنا ملزمة، جاي نحكي حكي. وهذه انترودكشن، والكتيب مالتكم موجود الماكلويد وديفيدسون. ما عندنا ملزمة، ما ننطي محاضرة بملزمة باب.
تمام دكتور.
اي coronary artery disease, when we say that there is coronary artery disease, we mean there is a narrowing in one or more of these blood vessels. And this narrowing, what is the cause of this narrowing, you think about it? Anybody can answer?
Accumulation of the lipid.
Accumulation of the lipid. Very good. What we call this accumulation in the pathology, in the pathological point? Atherosclerosis. Excellent. Other name or term in pathology, you can use it?
Hyperlipidemia.
Atherosclerotic plaque. So when the lipid accumulate in area of the coronary arteries, we call it atherosclerotic plaque. Okay? Usually, this arises from oxidized low-density lipoprotein. For this reason, that the low-density LDL, we call it the harmful lipid. So we have in the lipid profile, you have a beneficial or protective lipid, we call it HDL, like high-density lipoprotein, and we have LDL, low-density lipoprotein. You can recall it from your biochemistry lecture in the last year that the low-density lipoprotein is one of the harmful lipid which can lead to atherosclerotic plaque accumulation. So when there is narrowing of one or more of the vessel, this leads to what we call it stenosis of these arteries, and this will result in what we call it
Ischemia?
maybe.
very good. So ischemia mean decrease of the blood supply to the
Tissue.
tissue or organs. So there is ischemia. That's why we call it ischemic heart disease or coronary artery disease. So the ischemic heart disease or coronary artery disease are caused by narrowing. This is the etiology, are caused by narrowing of one or more coronary arteries due to the accumulation of the atherosclerotic plaque. Sometimes superimposed by thrombosis. It is not just a lipid core or fibrous cap. You will take it in pathology in details. Sometimes this complicated by accumulation of the thrombus, platelet aggregation, and leading to the complete narrowing of the or complete occlusion of the arteries. Okay, so this is an important etiological, pathophysiological process that lead to the coronary artery disease. Now, we will not enter in the details of this. Just we will go rapidly to the types of coronary artery disease or ischemic heart disease. How the patients with ischemic heart disease, as we mentioned, when we say ischemic heart disease or coronary artery disease, it means there is a reduction in the blood supply to the cardiac muscle due to the significant narrowing. You put a line under the significant, because if it is not significant, the patient will not suffer. So there should be significant, which means narrowing more than 60, 70% of the artery lumen. So due to the significant narrowing of one or more of the coronary arteries, leading to reduction of the blood supply and a nutrient or oxygen reduction. So delivery of the oxygen will be impaired to that organ which we mean it, the heart. So we mean that there is a reduction in the blood supply to the cardiac muscle, or reduction of oxygen supply to the cardiac muscle. This is the net result of ischemia. Is there any cause for ischemic heart disease without narrowing of the main one or more of these arteries? Anybody know?
ممكن يكون hypertension.
I mean pathophysiologically. So when there is obstruction or narrowing of the coronary artery, there is ischemia or ischemic heart disease. Sometimes the coronary arteries are not narrowed without stenosis, and the patient also suffer from ischemia because of what we call it increased demand. Severe anemia can result in ischemia. So if there is an imbalance between oxygen supply and oxygen utilization, the patient might suffer from ischemia, like for example in severe anemia, in thyrotoxicosis, increased metabolic rate. Okay, so not almost always ischemia or ischemic heart disease result from complete or partial obstruction of the coronary artery. There are other causes of angina or myocardial infarction with a patent or normal coronary artery. ما ندوخكم بيها، لكن لازم تعرفوها، مو في كل الأحوال، لكن من نحكي على ischemic heart disease نحكي vast majority of them are due to the obstruction. بس هل إنه واحد عنده normal coronary vessel without obstruction ويجي acute myocardial infarction أو unstable angina أو stable angina? Yes. Why? Due to the increased demand. Those with severe thyrotoxicosis, with high metabolic rate, with severe anemia, because there is what we call it increase the demand for oxygen, extra oxygen, they need extra blood supply. Okay. We will focus on another important point. How the patient before that, yes, what are the clinical varieties of syndromes؟ هذه مهمة تعرفوها وتجي تتكرر سنويا نسألها. What are the clinical varieties or syndrome or diseases that the patient with obstructive coronary artery or coronary artery disease or ischemic heart disease can be presented?
دكتور.
Or yes.
دكتور يعني العلامات المصاحبة للإسكيميك هارت ديزيز.
What are the diseases caused by ischemic heart disease, or what we mean by ischemic heart disease? Or in another way, my question, what are the types of ischemic heart disease, or how the patient with ischemic heart disease present to them?
إذا كان البلد سبلاي الجزئي angina.
Why you are speaking in Arabic? We should never use the Arabic words in our scientific. Okay.
Yes, when the blockage was when the blockage was a partial, there is angina. When the complete blockage, there is myocardial infarction.
Very good, very good, excellent. Anybody can answer also? What are the types of ischemic heart disease? Anybody?
دكتور, stable angina or unstable angina.
Excellent. بعد?
Myocardial infarction.
Myocardial infarction. Okay. So, in summary, the patient with ischemic heart disease can be presented into these varieties. He or she might present with what we call it chronic stable angina. The new term for it is a chronic coronary syndromes. Okay, هيتسجلوها chronic coronary syndrome or chronic stable angina. This is the first one. The second presentation, he or she might present with acute احنا قلنا chronic coronary syndrome. Other presentation, number 1 chronic coronary syndrome, number 2 acute coronary syndrome. What we mean by acute coronary syndrome? A, acute coronary syndrome type A يسمونه unstable angina. B, non-ST elevation myocardial infarction. C, ST elevation myocardial infarction. So you can see 3 types in acute coronary syndrome. And 1 type, we call it chronic coronary syndrome. So the patient with ischemic heart disease can present either with chronic coronary syndrome, we call it chronic stable angina, or with acute coronary syndrome. What we mean by acute coronary syndrome? Either unstable angina or non-ST elevation myocardial infarction or ST elevation myocardial infarction. Also, these are the main presentation of coronary artery disease. Either the patient with coronary artery disease might present with
sudden cardiac
death. Number 4, by cardiac arrhythmia. Number 5, by element of cardiac failure, heart failure. Gradual process, and the patient present with heart failure. And the most common cause of cardiac failure is the coronary artery disease or ischemic heart disease. Now, we will shift to what are the risk factors for ischemic heart disease. How we can divide the risk factors?
Blood pressure, hypertension, hyperlipidemia, smoking, diabetes mellitus, and diet.
Okay. So we can classify them into
major and minor risk factor.
فاطمة علي عبيد. وين فاطمة علي عبيد؟ السؤال لك. فاطمة علي عبيد. دكتور مبارك انت ويانا؟ اي فاطمة علي عبيد، سؤال لك. انا ما اريد تليفونات، بس حاطين مشغل هذه وراح اتابع واحد واحد. دكتور مبارك. اي فاطمة علي عبيد لك السؤال.
دكتور types of angina, types of myocardial infarction.
لا شنو السؤال كان؟ انت سمعتي له ولا؟
لا.
ها؟
لا.
منو يعيد لها السؤال؟
Risk factor of ischemic heart disease.
What are the risk factor of ischemic heart disease? How we divide them?
Those with diabetes mellitus.
Very
those
good.
with the hyperlipidemia.
Very good. Excellent. فإذا all of you know the major risk factor. ولذلك يفضل إنه نقسم الريسك factor for cardiovascular risk factors. On the top of them is the diabetes mellitus. Number 1, diabetes. The patient with diabetes are more prone to develop ischemic heart disease, more prone to develop acute and chronic coronary syndromes. You understand this point? So diabetes is one of the leading cause of cardiovascular disease or coronary artery disease. The second is the hypertension. Third is dyslipidemia or hyperlipidemia. And as we mentioned, that in hyperlipidemic patients, there is an increase in the cholesterol and mostly in the low density lipoprotein. And this will be oxidized and will be engulfed by macrophage. They form in your pathology, they will talk to for this details. they form what we call it foam cells in the wall of the blood vessel, which is the nidus for the formation of the atherosclerotic plaque or atheroma in the wall of the artery. This atheroma might cause 70%, 60%, 50%, according to its size, can cause the symptoms. If the patient had, for example, atheroma in 1 or 2 arteries, which size is 70% narrow, causing 70% narrowing or 75% narrowing, the patient might present with chronic stable angina. If this plaque rupture, will lead to activation of the platelet and the thrombosis, leading to complete occlusion of the artery, resulting in what we call it acute myocardial infarction due to the complete closure of the artery. So the major risk factors are diabetes, hypertension, hyperlipidemia or dyslipidemia, and all of you forget other important major risk factor, which is
obesity,
smoking. So these are the major risk factor for coronary artery disease. Minor risk factor like obesity, lack of exercise,
age.
You can see that the age, actually the age is one of the important risk factors for the cardiovascular disease. These diseases are more predominant in males than women. But after the age of the menopause, the women, the percentage or prevalence of these ischemic heart disease, due to the lack of the protective hormone, the incidence or prevalence of ischemic heart disease will increase after menopause, unless there is genetic or familial factors. So other minor risk factor or other risk factor, obesity, advanced age, male gender, lack of exercise, type of diet, all of these can add to the risk factor.
Family history.
Family history, sure, genetic and family history. And usually when we say family history, what's your name, Baba? اللي حكيتي family history.
نعم دكتور، زهراء صابر.
زهراء.
نعم دكتور.
امتى نقول هذا الشخص عنده family history of ischemic heart disease؟ هاي لكم شباب بالكلينيكال. يعني واحد امتى نقول عليه هذا عنده مثلا انت
دكتور يعني اذا كان البارنتز يعني الوالدين عندهم هيك شيء اسكيميا راح يكون هيك يعني؟
لا من يعرف؟
According to the age.
Very good. According to the age. مرتضى مو؟
لا دكتور رضا.
According to the age رضا. شنو المقصود بالايج يعني؟
Men under 55 maybe or less than 65 generally.
إذا male كان
under 55 or under 50 or under 65.
هاي الفيميل.
Females under 65 while male under 55.
Very good. Excellent. إذا الميل إذا كان واحد أبوه قبل ما يصير عمره 55 وعنده هيستوري مال acute myocardial infarction مثلا، أو أمه عندها هيستوري of acute myocardial infarction أو acute coronary syndrome before the age of 60-65, so we adopt that this patient has a positive family history of ischemic heart disease. بس مو his father, his age or his mother is 70 years old with they have ischemic heart disease, and we call it or classify that patient has a positive family history. You understand this point? This is very important point to focus on it. So positive family history means that the family history according to the age of the presentation. So we can call these are risk factor, major risk factor, minor risk factor. Stressful condition can be added to the also to the minor risk factor. Okay, certain types of treatment or drugs can cause ischemic heart disease without narrowing, like those who are using cocaine or amphetamine, and you know that the addiction and substance abuse is spread in our country nowadays. So drug abuse can result in coronary spasm, coronary occlusion, and acute myocardial infarction. All these are other additive or contributory risk factor, but generally we can classify them to the major risk factor and minor risk. Or we classify them into modifiable risk factor and unmodifiable risk factors. Okay? What we mean by modifiable risk factor is that what we can change or alter the fate of it. For example, the patient with hyperglycemia or diabetes, we can't control the diabetes, and we can, to lesser extent, we can modify the risk of development of cardiovascular disease. If the patient has uncontrolled diabetes, the incidence or the prevalence of that this patient has ischemic heart disease in the future is very high. But those with controlled diabetes, regular treatment, regular follow-up, we can lessen or decrease the incidence of their development of coronary artery disease. Same thing is applied for hypertensive patient. Same thing is applied for smoking. The one who give up the smoking, we can reduce the risk of the cardiovascular event. But unmodifiable risk factor, for example, those with genetic, those with family history, those with gender, male, we cannot modify this male or female. Okay. So advanced age, we cannot, you know that the ischemic heart disease mainly is the disease of the elderly, especially in the male after the age of the 45 or 50, the incidence will increase, and in the female after menopause or after 60 or 65. Now, how the patient with ischemic heart disease present? These are the types. Now, what are the signs and symptoms?
Maybe we have chest pain and the shortness of breathing.
The most important point, this is my message in this lecture. The message in this lecture is that I want you to define the patient with how the patient with chronic stable angina can be presented to the emergency. Okay, Baba, I have aim of this lecture. The main aim of this lecture is to put a highlight on the major and minor risk factor of the ischemic heart disease, put a highlight on the types of ischemic heart disease, and how the patient with chronic stable angina present and patient with acute coronary syndrome present to the emergency. Okay? Now, how the patient with chronic stable angina present with his or her symptoms in general, not in the emergency, because it is not acute. We call it chronic coronary syndrome or chronic stable angina. So how the patient with a chronic coronary syndrome or chronic stable angina present, or what are the symptoms of patient with a chronic stable angina? Yes.
Chest pain.
Chest pain. Sure. sure, most of our patients with ischemic heart disease, they suffer from the chest pain.
dyspnea.
So unless they are طبعا اكو قسم راح يجون راح نجي عليها اكو dyspnea predominant، هذولاك شو نسميهم angina equivalent. اكو مرات مرضى يجون what we call it dyspnea predominant symptoms due to the coronary artery disease، هذول نسميهم angina equivalent. هسه احنا هذه ما نحكي عليها، خلونا نحكي على الكرونيك ستيبل angina. الchest pain, whenever you have a pain, you should describe 10 point or more than 10 point about any pain. You should be aware of them, or you should ask about them in details. Even abdominal pain, loin pain, back pain, you should ask about 10 points. So about the chest pain, how the patient with the chronic stable angina present. The patient with the chronic stable angina present with chest pain or chest tightness. Site وين؟ لازم تعرف السايت.
يكون central or retrocentral chest pain.
الaggravating factor, relieving factor, الراديشن، الاسوشيتنج phenomena، التايمينج، الكواليتي اوف ذا بين. مو هذه لازم تسال 10 نقاط على البين. هذه تعلموها بالهيستوري تيكينج بابا، ما حكوا لكم اياها بالهيستوري؟
نعم دكتور اخذناه.
نعم اخذناه.
اي بين you should ask about the details of the pain. So the patient with the chronic stable angina usually present with retrosternal chest pain or central chest pain or left-sided chest pain that is aggravated by exertion for a few minutes or when walking for 20 or 200 meters or 300 meters, okay? And this pain usually retrosternal or left-sided, and it is a heavy in nature, or like a tightness, or like a band, or like a tearing. This pain usually radiated to the back or to the left arm, or even to the lower jaw. Rarely it will radiate to the right arm also. But usually it is retrosternal chest pain or left-sided chest pain, heavy in nature, or tightness is radiated to the back and left arm, aggravated by exertion and walking, and relieved by rest or by taking medication like sublingual nitroglycerin or nitroglycerin spray. This is a very nice description for how the patient with a chronic stable angina present or chronic coronary syndrome present. Anybody can tell me why this pain is different from that with that patient with unstable angina?
دكتور الستيبل انجينا يعني يكون بالاكسرسايز والستريس والستيبل ان ذا ريست.
Good. So
and the duration.
Good. So an important point are the timing and the duration. Other point is
last a few seconds or less minutes.
Usually it lasts a few seconds, less than minutes. Usually the pain of chronic stable angina is lasting a few seconds and relieved by rest. إذا not relieved by rest شنو هذا صار؟ هذا صار باتجاه الانستيبل angina. واضح؟ اذا البيشنت تريست صار عنده تشيست بين، هذا باتجاه الانستيبل انجينا. اذا not relieved by rest or medication هذا صار باتجاه الانستيبل انجينا. اذا البين become more frequent يعني بمعنى اخر when we say that this patient has a chronic stable angina, for example a teacher go from his home from الإدارة المحلية to إعدادية الجمهورية، خلينا نقول يبدأ المشي مالته من جسر الزيتون إلى إعدادية الجمهورية يوميا بالفلكة مالت البهو، بالتقاطع مال البهو مشي، يبدي الألم عنده من بالتقاطع ياخذ له يم البهو ياخذ له دقيقة دقيقتين استراحة، يروح الألم يكمل للمدرسة ماكو شيء. يوميا من يروح ويجي نفس المكان ونفس المسافة يتكرر عنده الألم. هذا شو نسميه شباب؟
stable angina.
chronic stable angina. إذا اجى من جسر الزيتون وورا فترة قام يوقف يم الفلكة مالت الترافيك لايت مالت سوري اللي قبل إعدادية الجمهورية، يوقف 3 مرات يرتاح، هذا صار هذا مور فريكوينت باتجاه الانستيبل. واضح؟ او هي الكرونيك ستيبل انجينا نقسمها الى كلاس 1 كرونيك ستيبل انجينا 1 و2 و3 و4. ال4 باتجاه الانستيبل بابا حسب on mild exertion moderate exertion and severe exertion. واضح؟ فاللي يمشي 500 متر ويلا يصير عنده الالم، بعدين قام يجي له الالم مور فريكوينت كل 200 متر يراد له 3 وقفات، هذا صار مور فريكوينت سيمبتومز، هذا صار باتجاه الانستيبل انجينا. واضحه مو؟
واضحه دكتور.
نعم دكتور واضح.
اذا الديوريشن مال الالم كان الالم يروح ب 20 ثانيه، هسه الالم صار يروح 3 دقائق يلا يروح، هذا صار شنو باتجاه شنو؟ باتجاه الانستيبل. زين اذا الالم كان حبايه انجسيد يروح، هسه الالم صار يراد له 3 حبات انجسيد تحت اللسان او 3 رشات سبراي انجسيد يلا يروح، هذا صار باتجاه الانستيبل انجينا. او اذا ما نريد نسميه انستيبل انجينا كرونيك ستيبل انجينا صار كلاس 3 وكلاس 4 اللي هي هاي كلاس انجينا. كرونيك ستيبل انجينا كلاس 1 2 3 4. ال1 وال2 اون سيفير اكزيرشن يلا يصير عنده تشيست بين او يمشي مسافه طويله يلا. واضحه الفكره؟ اوكي. صار عندنا فرق. اوكي احنا هذا الوقت نكتفي، بس اريد من عندكم تكملون بالكتيب مالتكم تقرون الساين اند سيمبتوم اوف اسكيميك هارت ديزيز، وتقرون الساين اند سيمبتومز اوف كاردياك فيلر، لانه اكو مصطلحات لازم تعرفونها. الاورثوبنيا مثلا، شنو تعريف الاورثوبنيا اللي راح نجيب عليها اسئله؟ الاورثوبنيا it means that the dyspnea on lying flat, usually it is a sign of cardiac failure, which is usually left-sided heart failure. This is what we call it orthopnea. Paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. We mean by it that the patient in the midnight or early morning become agitated, severe dyspnea, shortness of breath, opening the windows, trying and fighting for the breath due to the accumulation of the fluid in the pulmonary vasculature due to the left-sided heart failure. We call it paroxysmal nocturnal dyspnea. It's a sign of left-sided heart failure. These are the signs of left-sided heart failure, not the signs of right-sided heart failure. Definition of syncope. Syncope, we mean by it is a brief transient loss of consciousness. We have a cardiac syncope, we have a vasovagal syncope, we have a new central nervous system or neurological causes of syncope. We have many causes. Palpitation, dizziness, vertigo, sweating, leg edema, cyanosis, and all of these are features or signs and symptoms can be seen in patients with cardiovascular disease. Next lecture, we will talk about another subject in the cardiovascular disease. And as I mentioned to you, we have, I will try in the next lecture another colleagues from the internal medicine department will go and give you a clinical applications to the to improve your training in the hospital, and you will have a background about the how to deal with the patient. So the next week we will try to take 2 hours وتكون هذه المحاضرات أيضا مستمرة وعليها درجة وبالامتحان داخلة حتى الكلينيكال applied lectures. اوكي لأنه أنتم مرحلتكم كبيرة وراح يصير عندكم ديفكت بالتريننج مالتكم، فلازم يغطى بصورة صحيحة بطريقة الكيسز والكلينيكال سيناريوز والكلينيكال امباكت اوف سيرتين ديسيزز حتى تكون شويه تقدرون تسيطرون، لانه لا مريض يقبل انه المجموعه مالته 70 واحد يلتمون عليه ويفحصونه، ولا التدريسي راح يكون ينطي بالطاقه القصوى مالته. وان شاء الله نتمنى لكم الموفقيه. الحضور مصطفى تسجله ودكتور مبارك متابع العدد مالتكم هذا، وراح يكون ابدا احنا كان كل سنه المرحله الثالثه الباطنيه بها تساهل، نسبه نجاح بها اكثر من 90% 95%. السنه لا، الدوره مالتكم كبيره، هذا حرص عليكم. راح تكون الحساب من المرحله الثالثه على الباطنيه، وحساب خلينا نقول قوي. الحضور والغيابات والالتزام والمناقشه والتدريسات يكون الالتزام بها بالعملي 100%، راح يكون حساب عليها يعني ومتابعة مستمرة. أتمنى لكم الموفقية. إذا اليوم المحاضرة انتهت، والأسبوع القادم راح يكون عندنا من 10 ل 11، وبعدين 11 إلى 11 ونص نص ساعة استراحة، وراها 11 ونص إلى 12 ونص عندكم محاضرة ثانية. يلا بالموفقية باب. منو عنده سؤال؟ 1 أو 2؟ اوكي، بالسلامة ان شاء الله.